SafeHaven is a contract agency of the Tri-County Board of Recovery and Mental Health Services. The state sets its budget and filters it to each different Ohio department. And so in this case, it's Ohio Department of Mental Health and Addiction Services. That's then sent to each different county's ADAMIS board. And that's our Tri-County Board of Recovery and Mental Health Services here in Dark, Miami, and Shelby. So we're a contract agency with them. And also, we are partner agencies with each of the different United Ways, Dark County United Way, Shelby County United Way, and United Way of Miami County. We also have a number of the different foundations that fund us in their grant cycles throughout the years, and also from public donations. Well, I've been here 14 years, and the rewarding thing really is the people. Out of our brochures, out of all of our material, when I'm doing presentations, I'm always listing all these different classes and these bulleted points of what we have and what we do. And I always have to, prove different numbers, show different statistics that we have. But out of all those statistics, the important thing is that each one of those numbers is a real person that has gone through any kind of different struggles with their mental illness, anxiety, depression, schizophrenia, bipolar, PTSD, OCD, et cetera, and when people come in and we, get to hear their story, and really the most important thing is get the opportunity to be able to help them. That's what's always meant the most to me. No matter what the diagnosis that somebody has, we always emphasize just treating someone like a person. It goes such a long way when somebody comes in the door to be able to just simply be someone that's smiling at them and in a genuine way show them that you're happy to see them.
I stay with SafeHaven because honestly, SafeHaven saved me. I started here 14 years ago, knew very little about mental health, but was super excited to jump in and learn what I needed to learn and help the people that I thought I was helping. About a year and a half into my employment here, I found myself in need of mental health supports. I can remember many times coming to work wondering how I was going to help other people when I didn't know how to help myself. But ultimately, working here was what I needed. Other people recognized that I needed help and got me to where I needed to be. So I'm a living, breathing proof, so to speak, that SafeHaven does offer you help. SafeHaven does get you to a better place. I'm a firm believer that wherever you are in your life, if you don't want to be there, you don't have to be. I'm here because I know SafeHaven works.
We have 95 different sets of curriculum that's all evidence-based or highly researched materials that go a long way to helping any different mental health symptoms. But outside of that, I do surveys all the time for our membership, and our folks always tell us the same thing. It's not any of that list of things they can learn. It's that they always say what a great feeling it is to be part of the SafeHaven family. As cliche as it might sound, that sense of belonging and that feeling that they're really understanding, they're not alone, that is reaching them more than anything, because everything's volunteer for them to come in. They're choosing to come here, they're choosing to participate in classes. There's lots of fun activities that we work in there. We've got arts and crafts, we've got computers that they can get on. We have different video game systems that they can play together or we do in groups.
We've gone to the museums, we've gone to the zoo. Sometimes we just go bowling or to a movie. But the members get to pick, and we take all 4 buses and pack a lunch and spend a day out. So I get to see them in a different light than sometimes what I see them in here, and get to spend that one-on-one quality time just interacting with them and seeing how much fun they're having. Most recently, we had a Halloween party here. It was the first time we ever attempted to do something at night, and so everybody got dressed up if they wanted to. They came later in the day, and we made a big bonfire outside and had some games and did some different activities with them to help build a self-esteem and some awareness and some team building skills. And for a lot of our folks that were there that day, I think we had close to 65, a lot of them came up afterwards and said that's the first time they'd ever had a s'more. It's the first time ever. Things that I take for granted that I've done with my kids for years, it's very awesome, and it's a huge blessing to be able to offer that to other people.
Our folks are coming from, in many cases, coming from lives of poverty and lives of struggle with their symptoms and kind of all the side effects of those symptoms, where they don't have much at home. But they come into us, and as many people tell us, I wish I would have known about SafeHaven a long time ago, because they come in and see this and realize how they're really not alone, with so many other people that they can meet and so many things that they can learn for coping skills to help them get by and really get back to value again.
I get to come home to go to work sometimes, and that's kind of the way I look at it. I've known some of these people for 14 years. I've watched their children and their grandchildren and been a part of their lives for a long time. So I think the uniqueness of SafeHaven is that it's not a facility where you might go in 1 or 2 times and never go back. There are people who have been here their entire lives as soon as they got old enough to come in. And so that's one unique thing about us. We work really hard to make everybody feel included. We work really hard to make everybody feel safe so that they can be who they want to be. There are no stigmas attached to when they come in the doors and ask for help, and that sets us aside from a lot of other places.
Mental illness doesn't discriminate. It can be your mother, your father, your brother, your sister, or a best friend or neighbor, and it's really something that's all around us. It can be from the genetic side, of where people have come from great, loving, supportive families, and it can also come from different types of trauma and abuse that folks have gone through. But in any case, you know, we're all grateful to be here, to have such great staff at SafeHaven that are loving and encouraging and warm and caring and supportive, that are all about just helping every single person that comes in the door. You know, this job is really a blessing to have the opportunity to be God's hands and feet at trying to make life better for people throughout our communities.